Emily. I'm going to be your student nurse today, and we're going to do a physical assessment on you, if that's all right. And I'm going to first start out by washing my hands. Okay, and we're going to be assessing you from head to toe today. So can you tell me your name and your date of birth, please?
Dina Harline, 12/01/90.
Okay, thank you. All right. First, I'm going to inspect your scalp and check for any lesions or abnormalities or infestations, and you have none. Next, I'm going to palpate your ears and let me know if there's any pressure. No, okay. Next, I'm going to also inspect in the inside of your ears to see if there's any drainage or blockage. Okay. And there is none. There is no drainage and there is no blockage in your ears. Next, I'm going to inspect your eyes, and I'm going to first start with your eyebrows, which are both symmetrical and evenly distributed. So according to your facial features, and also your eyes are both distributed and evenly distributed, and also symmetrical to your facial features as well. I am going to check your eyes for for perla, which is if the pupils are equal and round and reactive to light and accommodation. So I'm going to see this real quick. Okay, wonderful. And your eyes are equal and reactive and round and are reactive to light, and also, oh yes, I want you to look at this pen and look behind me and then focus back on the pen if you can. Okay, and your eyes do accommodate. Thank you very much. And also, I'm going to pull up on your eyelids, and I need to check for to see if you have conjunctivitis or not. So I'm going to pull up on your eyelids. Please look down. Okay. All right. I'm going to pull down on your eyelids, and I want you to look up if you can for me. Wonderful. And you have no conjunctivitis, and the conjunctiva was pink and moist, and your sclera is clear and moist too as well. Also, I'm going to check the inside of your nose just real quick to see if your mucous membranes are pink and moist. So, and I can see that your mucous membranes are pink and moist, and also your nose is symmetrical also with your face too as well. I want to check for I want to check for if you can blow air out of your nose, and blow for me, please. Okay, and if you can blow here too as well. Okay, and we call that symmetry, and I didn't see any kind of deviated septum or any kind of occlusion in your nose. Also, right now I'm also going to check your mouth, and right now your lips are pink and moist, and I don't see any lesions or anything like that nature. Can you open your mouth, please, and say ah?
Ah.
Wonderful. Okay, your palate is pink and moist. Your tongue is pink and moist. Under your tongue is pink and moist, and I see no lesions or abrasions. And your teeth are evenly distributed in your mouth, and your gums are pink and moist too as well. Also, now I'm going to check for your thorax and see, for your neck, and I'm going to check and see if your trachea is in line with the rest of your body. Can you please swallow for me, please? Okay. It is in line with the rest of your body. Now I'm going to palpate your thyroid gland, and we're going to see if you have any masses or anything for your thyroid gland. And if you ever detect any masses in your thyroid gland, go and please see your doctor immediately. It could mean that you're either sick or you maybe have a mass of some sort. And I didn't see anything that was, I didn't feel any masses or abrasions. Now I'm going to assess your carotid and your jugular arteries. And first I'm going to palpate. Okay. And they, both your carotid and your jugular pulses feel pretty regular and strong. And now I'm going to auscultate your carotid and your jugular to see if you have any bruits. And you have no breweries, and if you did, I would have heard a swishing sound, and so I did not see any or hear anything that would be an occlusion in your carotid or your jugular. All right. Next, I'm going to move down to your thorax, and I'm going to palpate and inspect your skin. Your skin looks consistent with the rest of your body, and also. If you can take a deep breath, I'm going to feel if everything is symmetrical. And here it is. Okay. Next, I'm going to auscultate your lungs, and there's 8 points in your lungs. Okay, your lung sounds were clear, and I didn't hear any adventitious sounds such as rhonchi or crackles or anything like that. Also, I am going to go ahead and tell you about your heart and where it's located at. Your heart is located in the middle of your chest, and there are many pulses that surround your heart. I'm going to start by auscultating your first intercostal space, which is your aortic. I'm going to move to the second intercostal space, which is your pulmonic. Third intercostal space, which is your Erb's point. Fourth intercostal space, which is your tricuspid. Fifth intercostal space, which is your mitral valve. And fifth intercostal space, mid-clavicular line, and your left mid-clavicular line is where your heart is located at, and also where your apical pulse, which is the apex of the heart. And we're just going to listen to that for a few minutes. Okay. Your apical pulse sounds regular and strong. Okay. So, also, have you ever had a breast exam done before?
Mm-hmm.
Okay. Just in case you've forgotten, you should do a breast exam every month to check for any kind of abnormalities or masses or lumps or anything like that nature. If you could just do as I do, I'll just show you how it's done. Take your arm, put it behind your head. Take the other arm and start making circular motions around your axillary. And you're going to just go around and make circular motions around your breast. And you're going to, when you get to your nipple, you're going to take your nipple and you're going to squeeze and see if you have any discharge. And if you do have any discharge, you should contact your doctor, or if you feel any masses or lumps, you should contact your doctor immediately, because that could be a sign. Now I'm going to auscultate your back. And if you can, please turn so I can listen to your back, please. And there are 10 points of auscultating. But first, I'm going to go ahead and check your back and palpate your back to see if there's any kyphosis or scoliosis, which there's none. And now I'm going to auscultate your lung sounds in your back. And there are 10 points. And I'm also going to auscultate your lateral right lobe. And you can turn around. And right now, I didn't hear, your lung sounds were clear. I didn't hear any adventitious sounds such as bronchi or crackles or anything like that. I'm going to check your upper extremities now, which is your arms. And I'm going to check to see if skin color is consistent with the rest of your body, which it is. I also am going to check for your skin's turgor, which should be elastic, and it is. Also, the temp for both arms is both bilateral and equal, and it is. And now I'm going to take your brachial and your radial pulses. And both your brachial and your radial pulses are strong and bilateral. And now I'm going to check for your fingers, and just to check for any kind of signs of clubbing, which there is none. Now I'm going to check for your capillary refill in both your fingers. And it should be under 3 seconds, and it is. And so also, and your nails looked like they were free of any kind of fungus or any kind of abnormality, and they looked clean and clear of any kind of fungus. Also, I'm going to check your range of motion. If you could copy what I do and do what I do. So reflection, okay, extension, okay, abduction, and adduction. Okay, awesome. All right, and if you could push up on my arms, please. Okay, and also push down on my arms. Wonderful. You have wonderful strength in both your arms, and they're both equal and bilateral. Okay, if you can please lay down, I'm going to go ahead and inspect your abdomen and also auscultate that. I'm going to auscultate first, so that way we don't hear any weird sounds when or have some strange sounds when I'm palpating. So we'll auscultate first. And I'm going to start with your right lower quadrant. Okay, now I'm going to move to your right upper quadrant. And now I'm going to move to your left upper quadrant. And now I'm going to move to your left lower quadrant. And your bowel sounds were very clear. I didn't hear any hyperactive or hypoactive sounds. And if I didn't hear any sounds, if there is an absence of sound, then I would auscultate each quadrant for 5 minutes. And I could hear sounds in all 4 quadrants. Now I'm going to palpate, starting with the right lower quadrant, to see if there's any distensions in your stomach. Could be signs of masses. Okay, now your right upper quadrant. Okay, left upper quadrant. Okay, and left lower quadrant. Okay, thank you very much. And I didn't feel any distensions or anything like that of that nature. Okay. Now I'm going to check your lower extremities, and I'm just going to see that your skin, which is consistent with the rest of your body. Your skin temp is bilateral and equal on both sides. Okay. Also, I'm going to feel for your dorsal pedis pulses, which I always had trouble saying that word, and dorsal pedal pulses, which are equal and bilateral on both sides. Also, I'm going to check for your posterior tibial pulses, and which are bilateral and symmetrical on both sides too as well. Now we're going to do, if we can, range of motion with your leg. So here we go. It's going to be reflection, extension, adduction, and adduction. And you did a great job. And I would also do this with your other leg too as well. Now I'm going to check for your capillary refill on your toes. It should be under 3 seconds, just like your fingers. And it is under 3 seconds. Now I'm going to test the strength of your legs. If you could push up on my hands, please. Okay. Now if you can push down on my hands. Ooh, good job. And I believe that concludes our physical assessment of you today. Do you have any questions?
No.
Okay. Thank you very much, and you did an awesome job.